So I want to welcome everyone to today's Medicare 101 presentation. Today I will be reviewing a 5-step method that was developed with the purpose of teaching new brokers or showing new brokers a 5-step method that you can always use for every single client that will help you to qualify and choose the best possible products for your client. I'm doing this because in my particular area in Florida, we have in my county, in Miami-Dade County, I have 73 different plans to choose from, and as you can see, that is a daunting number for someone who has just started their Medicare career. And so I started trying to come up with ways that I could give new brokers a method that can be used on every single sale to try to decipher through all of the options that may be available in your territories. It can't get any worse than 73, but even if there's 20 or 10, again, how do you pick the one or the two that you would want to offer your client or refer to your client? So this is the reason that this method was developed, and the goal for today's training is that you learn each step, that you have something that you can go back to as a rule guide for every single sale. And I promise you, if you follow this 5-step method, you will be able to get to recommend the best possible plan for your clients. So let's talk about some trends that are very interesting for all of us in this field and very exciting for new brokers coming in. So by 2030, the United States for the first time will have more 65-year-old residents than children. So this is a very interesting trend, and I put this here so that you have it as a talking point with your clients, because the older population in the United States is growing, and for over the next decade, our client base is going to be growing. That's what that means. How exciting is that we're coming into an industry where the amount of people that we can help is actually growing? I would say that that is very impactful as far as our careers and our opportunities within this field. The next trend that I wanted to show you is that Medicare eligibility starts at 65, but there are a lot of baby boomers that actually are no longer going to be able to retire at 65. They'll have to retire at 66 or later. So being that the case, now that creates a niche market within the employer group world. What does that mean? If a 65-year-old gets there or is eligible for Medicare at 65, but they're still working and they have employer group coverage, then we can actually help that 65-year-old determine whether the insurance that they have in their employer group is better or not than the Medicare coverage they can get. This is, again, it's a niche market. I can prepare or can talk to anyone who is interested in learning more about this niche market. I work within this market and can tell you it's great. There's a definite need for Medicare advisors within this space, because HR, human resource administrators, who are the ones that the employees go to with these questions, are not taught this in school. And there's really no one that they can turn to other than their commercial group coverage brokers, who are also not, for the most part, Medicare experts. So there is a great opportunity here, and we can talk about that at another time. I just wanted to make note of that. This slide explains the 5-step method. I'm going to go through it, but I would recommend that each of you print this slide or somehow maybe create yourself like a form or something where you can use every single time that you work with a new client so that you do not forget to go through each one of these things. So let's talk about step one. Step one is, do you have end-stage renal disease or kidney dialysis? So I included the verbiage from the actual Medicare.gov policy that speaks to end-stage renal disease. So many new brokers make the mistake of thinking that there are end-stage renal disease or kidney disease type chronic plans, and at least in Florida, they do not have that. And it is my understanding that if someone has end-stage renal disease, which means that they need kidney dialysis actively in order to stay alive, basically, they absolutely cannot enroll in any Medicare Advantage plan. So what happens when you meet someone, and the reason that I made step one, ask your client if they are on kidney dialysis, is because if they tell you yes, you have to stop immediately and you cannot take an application or submit it. There is an actual marker in Medicare that if you did submit an application and the marker shows that the person is on kidney dialysis, they that application will be denied. So in the event that maybe someone has been on kidney dialysis through their commercial insurance and they haven't transitioned over to Medicare, this slide can help you speak to the type of assistance that Medicare can provide for them. You cannot take an application, and I would just refer them to contact Medicare directly for additional information. So step one is very easy. Make sure you don't get caught not asking this question, because it has happened to me very early on where I would spend an hour or so with my clients, not ask the question. My client looked very healthy. They didn't look like they were sick at all. And in fact, you know, an hour into the conversation, I would find out, and then I would have to stop everything, and then I just wasted a whole hour. So that is why that is step one. Okay, step two is verify if they have Part A and B. This is step two also for a reason. If someone does not have both Medicare Parts A and B, you cannot take an application. It does not mean that you won't be able to do an application later on, but it means we have to help them a little more in getting whichever one of the two parts are still missing. So wanted to mention the fact that since April of 2018, Medicare started sending out the new cards. The old ones had the person's social security number. Now, they used that card for 52 years, but now it is a mandatory requirement that you do not use the old card. And if you do come across someone who still has their old card and hasn't received the new one, they can you can help them either by going online to ssa.gov and creating a profile for themselves and requesting their card online, or they can call this 1-800-772-1213 number, and they can actually request their card verbally also. So here's this stop sign, and it's there for a reason. Ask this question. Make sure that the person has both Medicare Parts A and B. So how does someone qualify for Part A and B? So if you run across someone that does not have either one, I've provided for you the instruction of how your client can actually qualify for both. So Part A, the person must be 65 and have worked in the United States for 10 years and earned 40 quarters. So note, with less than 40 quarters, the applicant can opt to voluntarily enroll and pay a monthly premium for remaining quarters or pay for the entire premium. We're going to go into how much these premiums are. Social Security is the one that determines the cost based on the person's work history. Part B, the person must be 65 and have been a U.S. resident for 5+ years and pay a monthly premium. With someone working less than 10 years in the U.S., there will be additional requirements like qualifying for Medicaid if you live in Florida in order to help pay for the cost of Medicare Part A and B. So this is, I provided for everyone a permanent resident card, which is what someone that is a U.S. resident will have to show how long they've been in this country. And I would say point your attention to the resident since area of the card, which literally shows the actual date of their residency. And for them to qualify for any benefits, they must be residents for 5 years from that date. Additionally, if a client has been receiving disability benefits for 24 months, disability benefits are is a financial benefit from Social Security based on the person having a medical disability. And if the person had earned 40 quarters prior to their disability benefits starting, then the applicant may qualify for Medicare before the age of 65. So these, again, these are basic rules that you must basically memorize and understand when you are working in the world of Medicare. You must understand how people qualify for Part A and Part B. Also note that there may be people who qualify that are less than 65 through disability. Now, Social Security, you're going to also need to program this number as a contact in your cell phones because it's a number that you may be giving out all the time, and it's just easier to have it available for your clients in the event that you run across someone that doesn't have Medicare Part A or Part B, and you need to refer them back to Social Security for them to find out what they need to do to actually get either part. So let's talk about the different premiums and what Part A and B actually cover. So Part A is hospital insurance, and it covers inpatient care, skilled nursing facilities, hospice, and home health care. For Part A to be premium-free, the client needs to have earned 40 quarters or 10 years of full-time employment. Otherwise, Part A has a premium of $458 in 2020. These premiums can change yearly. Now, if a client qualifies for Medicaid because of low income, and the qualification would be $1,061 gross income for a single status in 2019, then the state of Florida will pay for that Part A premium. So the Part A premium is $458. If someone has a gross income of less than $1,061 and applies for Medicaid through the Medicare Savings Program, that Medicare Savings Program will pay for that $458 premium so that the person can get Part A. And once they get Part A, they'll also pay for Part B, and then the person can actually get a Medicare Advantage plan to help them cover their expenses. The 2020 Part A deductible and coinsurances for someone who has Part A only is $1,408 for every admission period through days, hospitalization days 1 through 60. Once they pass the 60th day inpatient, there is a daily coinsurance of $352 for days 61 through 90. And then past 90 days through your reserve days, there's a daily coinsurance of $794. Why are these numbers here. These numbers are here for you to be able to show your clients that these costs are what Medicare Advantage picks up when the person has Part A and B and they join a Medicare Advantage plan. The Medicare Advantage plan actually covers all of these costs. When the person has Part A and Part B and they have not elected to add a Medicare Advantage or a supplement to their Part A and B, these are the expenses that they would be subjected to. Part B helps to cover services from doctors and other healthcare providers, outpatient care, home health care, durable medical equipment like wheelchairs and walkers and hospital beds, and many preventive services. So what I usually tell my clients is Part B covers everything that happens when someone is not hospitalized. So things like x-rays, any type of diagnostics, physical therapy, all of those types of things, any specialist visits, doctor visits, outpatient surgeries. So even though a surgery may be conducted in a hospital, it's the person went in and comes out the same day, that's considered outpatient surgery, and that is covered under Part B. So Part B covers 80% of all of these services and has a deductible of $188 in 2020, and this changes yearly. So Part B also has a premium, and the premium can be paid in two ways, really three if the person has Medicaid. Premium is income-based and can be paid by Social Security deduction or a bill, or if the applicant qualifies for Medicaid due to being low income, the state can pay for it. And this is, this is what we talked about in the prior slide, that if someone has an income of less than $1,061, they may be eligible for Medicaid, and if they are, they may be eligible to have Medicaid pay for this premium. Otherwise, you have to pay for it out of pocket. If you have not retired, you can actually just pay for it like a bill. If someone is already receiving Social Security benefits through their retirement or disability, then the premium will actually be automatically deducted from that income. So the premium actually also has, it could be different than the $144.60, depending on the person's income. So this is called IRMA. And what I usually do is I have this table available with me when I'm speaking to someone who may be higher income. This is the standard, which is $144.60. But if someone is in this level of income, and this is filing individual or filing jointly, and we're talking about gross income, then the Part B premium starts going up in price. And this is monthly premium for life, as long as the person has Medicare. So, for example, people that are in a higher income bracket that might not be interested in a Medicare Advantage plan and might be interested in supplement, these people will have to pay these premiums in addition to the supplement premiums. We're going to talk about that later on today. So we're still in step 2 because I am explaining all of the things that are involved in Part A and Part B, the cost, what Part A and Part B covers, and how to make sure that you can help basically anybody that you can talk to in getting Part A and Part B. So now we're going to come to step 3. Step 3 is for you to make sure that you have an election that you can use for the enrollment anytime during the year. This presentation is based on Florida election periods. Most of these are also national, But please make sure that you keep in mind that if you are in a different state, there may be different election periods that are available to you. So these are the most common. So IEP is the initial enrollment period, which is when someone comes into Medicare for the first time. They've never had Medicare, they're turning 65, and they just got their Medicare Part A and B. Those are called the initial enrollment periods. Dual is when someone has Medicare and Medicaid. These folks can make changes only once every calendar quarter and only until the third quarter of the year. Low-income subsidy is something that is it's an additional federal help that low-income grossing people can actually qualify for, and it helps them with their Part D or medication costs. So these people can make changes only once every calendar quarter until the third quarter of the year, similar to duals. Chronic, do they have a qualifying chronic illness? These folks can make one change per year to specific companies that offer the chronic plans. For example, locally, I have a plan called Preferred Care Partners that has a diabetic plan, and if I have someone who could benefit from a change during the year, they are allowed one change per year into these chronic plans. So I urge you in your respective areas to understand or learn which are the chronic plans available and be aware of this as a possible option during the year once we're done with the open enrollment. The annual enrollment period is October 15th through December 7th. The open enrollment period is what we're in actually right now. Today's January 21st. So we are going to be able to continue selling until March 31st. During the open enrollment period, there are two types of people or two different things that we can do. We can help someone who is currently in a Medicare Advantage or an MA plan switch to another plan and or have that person disenroll from that plan, go back to original Medicare, and then pick up a supplement and a Part D plan. So those are the two things that can be done in the open enrollment period. In the annual enrollment period, basically anyone and everyone can do any type of change that they would like to do. That's the period of time where the rules are relaxed and people have the opportunity to look at their current insurance and determine if they need to make any changes. Another one is moving. So if someone has moved into the county within the last 60 days, the trick here is that the person must have changed their address with Social Security. So I've come across people who moved, say, 3 or 4 months ago into the area. They changed their driver's license, but they never called or contacted Social Security to actually change their address. So that is the determining factor for the 60 days. I've been able to use this eligibility election to actually help people change the plan that they had before they moved to something that locally serves them better. And I've been able to help them by asking them if they changed their address with Social Security, and even if it's been more than 60 days since they moved. Has the person lost employer coverage? So if the person has an individual ACA Obamacare policy, that does not count. As a matter of fact, if the person qualifies for Medicare Part A and B and they have any other type of coverage, they potentially will be in a late enrollment penalty or a penalty phase, and we definitely need to help those folks. So when somebody loses employer health coverage, either because maybe they kept working after 65 and maybe now they're 68 and now they're retiring and they want to move or need to move from employer health coverage into Medicare, that is part of that employer group coverage space that I mentioned earlier, and we can definitely help them anytime during the year. There are also 5-star plans. Again, in my area, I have several plans. I encourage you to look within your territories and determine if there are any 5-star plans available. You can enroll into a 5-star plan 365 days out of the year. It's actually a great option for a lot of people. And then the final one is a later enrollment for Part B. So those people that maybe turned 65, they were still working, they kept their employer coverage, they applied for Part A because it doesn't have a premium, and they never applied for Part B. So now those people are retiring, they go ahead and ask for their Part B, and their Part B is provided to them into the future. So say it's January now, they're going to have Part B effective February 1st, but their Part A may have been effective 2 years ago. So you can enroll them for 2/1 of 2020 into a plan. If you're using that later enrollment election, in this particular case, there is a second election, which is the loss of employer coverage, in which case you could enroll that person after 2/1. So sometimes that's an example where there may be actually 2 elections or sometimes even 3 elections available, and you will have to learn how to actually choose the one that is the most applicable. And at times, choosing the right election period will determine your commission. So we definitely have to understand how to use these different election periods. Okay, so step 4 is we've got to take into consideration the person's physicians, their specialists, any primary care physicians, and hospitals, because if you are working within the Medicare Advantage world, as you know, Medicare Advantage has networks of physicians that every single company goes by. So, for example, within Miami-Dade County, within the same county, I could have, 5 companies that work with a particular hospital system and the rest of the companies that don't work with that system. And if somebody says to me, Lupe, I want to make sure that I can go to Baptist Health. All right, well then I just narrowed down my options from the 73 that I had to possibly, 20, because out of all the plans available, only 5 have products that work within that network for Baptist Health in my example. So, if you need to ask, do they have a PCP or physicians or a hospital network that they're interested in? And if the answer is yes, then, find out what plans that PCP is contracted with. So, for example, I've also, depending on my client, I'll either ask them to call their PCP and basically ask them what Medicare insurance plans they're contracted with. If I don't feel that they can handle that call, I will call myself and find and make sure that I have the right information. If the person says, no, I don't have a PCP or a physician or any network requirements, then you can make a recommendation, based on where they live and based on what type of doctor they're looking for. Locally, I've got a lot of medical centers or clinics. Some people like those settings, some people don't. So we have to have this conversation. The most important thing is that you understand that if a person says, yes, I have Dr. Smith, who is my primary care, or Dr. Smith is my cardiologist who saved my life, who operated on me, open heart surgery, 5 years ago. that's very, very important that you keep that in mind. And you must look for these physicians within the provider directories of each company online. We no longer work with paper provider directories because these become null and void basically the minute they're printed. And I'm happy to see that we've really gone electronic. So we can talk about that. I can provide a list for my local folks of the different websites to go to each of the carriers and be able to look up the different physicians. That is a very important tool and function that you will all need to learn and be able to manage. The other reason why you have to do that is because when you're filling out applications, if you're filling out a paper application, you will have to put the provider ID numbers for that plan on the application. And as you can see in my final bullet, provider ID numbers actually change by plan. So a lot of people, when you call, they'll give you the NPI number for the doctor, for example. Well, that is a standard number that is used for billing, and that is not the number that the payers or the different carriers use for purposes of their networks. So I want to make sure that you keep that in mind. So step 5 is asking about their prescription drug needs and expenses. I have a separate class that has to do with Part D and the Medicare Plan Finder. And I have a recording of that one and can send that to anyone that is interested. Today's recording or training doesn't go into this in particular, but this slide will make sense after you have learned about Part D. You should have learned about Part D within the AHIP training. And if you are Humana certified, Humana also does a very, very good job at going through Part D. If you haven't reviewed that since you became certified, I would recommend that you go back and review that material, because this is step 5. This is actually one of the most important steps in helping the person select the right plan. And it is not something that you can skip or learn really within an hour. It's something that you have to master. So I highly recommend that you go back and review your Part D knowledge, and we can go through it afterwards as well. So how and where, do we as Medicare brokers fit into the puzzle? Once someone has their Part A and B, and once we've collected and gone through all of this information, again, in Florida, what are all the options that someone has? So this is a diagram that I actually use. I have it copied. I have it in my, bag. And if I'm talking to a new client that just came into Medicare, this helps to actually provide a visual for the client of what this is the universe of all the possible options that someone has when they come into Medicare. So I'm going to be going through these one by one. So option 1, or actually step 1, is that they actually get their Medicare card. We went through that already. I'm putting here for you a reminder of what these cost. Part A has a 0 premium. Part B, excuse me, is now $144.60. I will update these this deck before I send it out to everyone. But apply for Part A and B. Part A is typically premium free and earned by someone collecting 40 quarters, and then Part B has the monthly premium. I'm going to add an asterisk here just to accommodate for the fact that if someone has Medicaid, then Part B could also be premium free, because Medicaid will pick up that cost. Once they get their Medicare card, then they have 3 options. Option 1 are called Medigap or Medicare supplements and are sold by private insurance companies. So that's what this box represents. These policies have an additional cost to the Part B premium, and these range from $100 to $275. I'm also going to update that because I want to bring it up to approximately $300. People who retire at a later date and come into the supplements with older than 65, we're looking at already Medicare supplement premiums above $300. These policies are sold in also letters, so policies A through N. They have standardized coverages, and Plan F actually stopped being sold for people who have Part A and B effective dates of after January 1, 2020. If someone has Part A or Part B or both prior to 1/1/2020, they actually can still apply for Plan F. So that's what this box represents. This box represents Part D. When you have a Medicare supplement, what that is basically doing is covering all of the costs that Part A and B of original Medicare are not covering. So what I like to tell my clients is if you take your Medicare card and you take the supplement and you put them together, that gives you 100% Part A and B coverage. Now, you still don't have coverage for Part D, which is medication, because Medicare does not cover Part D. Medicare only covers Part A and B. So we have to buy a separate policy for Part D. These are also sold privately. These policies also have additional costs, and they differ in coverages, they differ in their formularies, and in the deductibles. And all Part D plans are also available in the Medicare Plan Finder. So for those of you who have never seen the coverages for the Medicare supplements, this is the chart of the supplement or Medigap benefits and which ones of these coverages cover and how much. I would recommend that for someone who is coming into Medicare after 1/1/2020 for both Part A and B, that you start out with Plan G. Plan G is exactly Plan F, and the only thing that Plan G does not cover that Plan F does is the $198 Part B deductible that's effective in 2020. Otherwise, G and F are identical. So I would start there if your clients are not eligible for Plan F. Moving right along, and we're not going to spend too much time on this because I actually do have another separate class that I do, is option 2. If your client who just got Part A and B happens to be someone who is low income determined by someone who earns in Florida, as of the last chart that was provided, someone who earns less than approximately $1,200 gross income per year as an individual, then this person may qualify for Medicaid. When the person gets Medicaid, they are also provided the low-income subsidy or Part D. Low-income subsidy is Part D and medication help, and it may also be available for people that don't qualify for Medicaid but are still considered low income. This chart is the last chart that was provided. This gets updated sometimes twice in a year. And basically, anything above the orange line in gross income for an individual or a couple is what determines their eligibility for the Medicare Savings Program and for Medicaid. And then below this line, people will also qualify for low-income subsidy and but will not qualify for Medicaid. Don't worry about that. That's a little bit confusing, but I wanted to at least provide you with the latest financial income and assets table to just at least give you an idea of when you're talking to people. If you notice somehow that they are low income, you can have this chart with you and see if they may be eligible for assistance. If they are, they can apply, or if you feel that they may be, you can send them to the Department of Children and Family for assistance in applying for Medicaid and the Medicare Savings Program. Option 3 is the Medicare Advantage Part C option. This option basically takes over the Medicare coverage and combines Part A and B and adds coverage for Part D, all under one umbrella. These policies also include HMO and PPO benefits and typically have no additional cost to the Part B premium. Again, I'm speaking in Florida. I know that there may be additional costs that Part C brings in different states, and you definitely want to go and use the Medicare Plan Finder to determine if these HMO or PPO Medicare Advantage plans have additional costs to the costs that we've already reviewed for Part A and B. And this option is also represented by private insurance companies who have contracts with CMS or Medicare to provide this coverage to enrolled members. The most important thing to tell your members when they opt for this option is that this option, so let's say that they are enrolled in a Humana, HMO, or PPO plan, Medicare Advantage plan. So then that is the insurance that will take care of all of their health care needs, and they can put their Medicare card away. They won't need to show it when they are accessing their health care benefits, because Medicare Advantage bundles basically everything together under one roof. So option 3, you must consider different things. So the out-of-pocket costs with respect to different co-payments that may be applicable in these policies. Benefits coverage, prescription drugs, doctor and hospital choices, and their quality of care stars rating. So in Medicare Advantage, there are basically 2 different types of products. There's a core or basic product, which includes Part B premium give-back plans and low-income subsidy plans. And there are also special needs, which are considered dual for people who have Medicare and Medicaid, and chronic for people who suffer from such chronic illnesses as diabetes and or cardiovascular disease, as an example. There may be others within your region. Actually, within Florida, recently I've also heard of asthma and COPD-related chronic condition plans. So again, in Miami-Dade County, and this is fairly across also Florida, but definitely differs by state. These are the different companies that offer Medicare Advantage, HMO, and PPO products. So one thing to walk away from today's presentation is that there is no one-size-fits-all. When new brokers are getting started, I usually recommend at least 2 different carrier appointments, because you cannot just carry one product, because not everybody will be able to use that one product. So one size does not fit all. So that brings us to using the Medicare Plan Finder, which is, again, the tool that I have a separate training on and a separate recording on. This is the website for where to go to use the Medicare Plan Finder. This is another little snippet of why it is important to use the Medicare Plan Finder specifically for drug costs. So if you'll notice here, there are 3 columns. Each column represents a different carrier that we selected for this example. We want to make sure and use this tool to make sure that the medications that the person is taking, in this case, 8 medications, are all covered within the formulary of the plan that you are considering. In this case, 8 of 8 represents that all 8 of the medications are in formulary. If ever this was different, then you have to pause and definitely take that into consideration when recommending a plan, because if 7 or 6 of 8 of someone's medications are covered and the other ones are not, I would not recommend that plan for that person. The other thing is I wanted to say we usually recommend using 2 different pharmacy chains. Look at the difference of cost between CVS and Walgreens in, for example, Aetna versus the other companies, right? And also mail order. Look at mail order here is less. In these 2 cases, mail order is more than if they went to retail. In this case, it's not. So I wanted to point this out to show you, give you a visual that absolutely one company is not the same as another, and that it's imperative that you follow my 5-step method to collect the information that you need to help you make this decision for your client. Lastly, let's talk about commissions for Florida. Again, if you are somebody that's seeing this from another state, definitely reach out to your upline or your regional business manager from Advocate Health who can help you. But basically, if somebody is new to Medicare, so they got Medicare Part A and B for the first time, their commission is going to be $510 no matter when during the year you sell it. And the plan changes are a little bit different. So actually, I will edit this. This should be 1/1/2020 and thus far. So if someone, let's say, is in one plan, a Medicare Advantage plan, and you change that person to another Medicare Advantage plan during the year, the actual commission will be based on the effective date of that change. So, for example, say you move someone effective, and they're going to be effective 4/1/2020. So your commission for that enrollment effective April is going to be $191.25. And that commission goes down, as you can see. What you need to keep in mind is that, let's say that in all of 2020, you sold 50 policies. Then the residual starts in 2021 for all of those 50 policies, no matter if they were new or plan changes. So you will start making $21.25 per month for those 50 policies. So approximately a little over $1,000 on a monthly basis if all of your 50 enrollments are still on the books. This is why retention for you is very important, and why we have gone and developed this 5-step method to help you make sure that you are enrolling the person in the plan that they belong and that they will hopefully stay in for the duration, so that you don't have any changes from year to year or have as little fluctuations as possible, and that will in turn help you grow your book of business. Medicare is not a transactional sale. Medicare is a consultative sale, and it is one where you are highly focused on the integrity of your book of business and not necessarily in how many sales you make. We've basically finalized the 5-step method with the commissions. I wanted to just add a few slides here that you can look at on your own to help you get started with your personalized marketing plan, which any of our the Advocate Health advisors, regional business managers can help you further with. But you basically can develop the marketing plan by asking yourself these 6 basic questions. And we've provided here the next 3 slides to help you network and canvas the different areas that you live in and work in and play in, and understand that you basically need to just make yourself visible and known and active within any of the senior community areas in your region. So I want to thank everyone for attending today's webinar. I will be just making some minor edits to the programming today to include and update several pieces of information, and we'll be sending this out to everyone for review. So for those of you on today's webinar, I will also be ending the recording now and opening it up for any questions that anyone might have. Thank you.